Hello, everyone. Welcome to our program, Focus on Seniors, Paying for Long-Term Care and the Benefits Enrollment Center, which is co-sponsored by the Blount County Office on Aging and the Blount County Public Library here in Maryville, Tennessee. I am Melinda, a reference librarian here at the library, and I am so happy to welcome you to this, which is the first in our 2021-2022 series of programs which focus on the interests of seniors. As many of you know, in the past we held our programs here within the library building, and we had hoped to begin doing that again this fall. However, due to the continuing impact of COVID-19, we decided it's probably safest and wisest to hold this, our September program, online. For information on future programs, for the locations and formats, please check back with us by phone or online for updates on those. In the meantime, I'm so happy to say that one thing that has not changed during the pandemic is our continuing partnership with Joani Shaver, the director of the Blount County Office on Aging, and with her wonderful colleagues, including Teresa O'Mary, who is the Benefits Enrollment Manager of the Savings Checkup program there. I would like to thank Joani and Teresa so much for being here today. Through the magic of Zoom, we will be able to hear their voices and see their presentation. I'm sure you are eager to hear what they have to tell you, so I am now turning the program over to their capable hands and voices.
Thank you.
Thanks, Melinda.
Thanks, Melinda.
We are excited to be able to reach out to the community regarding the Benefits Enrollment Center that we have out of the Office on Aging and the enormous amount of help that we're providing to the community. In 2019, there were about 4,200 local residents who were eligible for help with 5 federal benefits and didn't mostly know that they were available. The benefits help with health care, with prescriptions, food, and energy assistance. The main reasons that they hadn't was either they didn't know that these programs were available, they tried to apply, and the enrollment forms were so complicated that they couldn't complete them, or they couldn't gather the documentation that's required. Many of our clients through our enrollment center have no family help, and therefore they need someone to guide them and encourage them that this is a possibility and it really will help them, and that they deserve every benefit because they paid for it through their entire life. The Savings Checkup program began with a grant in 2019. And what we do is screen people over the phone now, and we complete applications over the phone. We used to go to people's homes. That was the concept, was bringing the service to the people who were homebound. But now we screen them, see what they're eligible for, and help them complete the applications over the phone. Then we mail a checklist of the required information and documents that for each program that they qualified for. We usually have them either drop them off, mail them, or we sometimes go to their house and pick them up. We scan those documents along with all the application forms, and we email or fax them from our office. So that's the process. Since January of 2019, so in the middle of a pandemic, mind you, we have enrolled 1,134 Blount County residents in 1,535 program enrollments and brought in $3.25 million in tax benefits to Blount County residents who desperately needed them. So we are really proud of this program. And I'm very proud of what Teresa and her team accomplishes every single day. The 5 federal benefits that our program is charged with enrolling people in are 10 Care Choices, which is Medicaid. It's called 10 Care in Tennessee. The Low Income Subsidy, which helps with prescription costs. The Medicare Savings Program, which helps paying the premium for Medicare, the monthly premium. The SNAP or food stamp program, and the Energy Assistance Program. These are 5 federal benefits that are all qualified financially. So there's a financial qualification that is required. And that's where it gets really tricky and where our staff has to keep up with the latest income levels and the changes in regulations. So it's complex, and we're just really, really thrilled that we're able to help our local community and the residents access these benefits that they paid for, they're paying for through their taxes. And now I'm going to turn it over to Teresa, and she's going to focus more on 10 Care Choices.
Okay, thanks, Joani. Well, I want to touch base before we move on to 10 Care Choices. I want to just spend a brief few minutes talking about LIHEAP and let everybody know that that is an income-based program and not a resource-based program. What that means is regardless of the amount of savings and cash resources that you have, if your gross income meets the poverty guidelines on a monthly income, on your monthly income, then you can qualify for energy assistance. And there's a lot of myth about that. The other thing is about your SNAP, which is formerly known as food stamps, is it's based on gross income, and as an elderly or a disabled individual, you can get more SNAP benefits. That's an allotment of cash resources to purchase food if you have an extenuating amount of medical cost and prescription cost, as well as items that are required by your doctor that are over the counter. And the current temporary emergency allotment that was stemmed from the COVID-19 legislation added about 15% to our SNAP benefits through September. That is getting ready to end. But on October the 1st, due to the recent legislation, the USDA is doing across the board 25% increase beginning October the 1st of this year. So what that means is that the original allotment for a person, for one person in the household, was $234. Well, that's going to increase to $250 as the maximum amount allotment of food stamps that someone could receive. There's a lot of misunderstanding. The gross income standard for the elderly and disabled individuals in the community is much higher. It's 165% above the poverty level versus those who are not elderly and disabled. And but the net income after all your expenses are paid via shelter costs, the allowed expenses on a food stamp allotment is shelter costs, medical costs, anything, your phone, your water, your electricity, your rent, your mortgage, your taxes, all of that shelter expense and medical expense can be deducted. And if your net income is 30% or less of your cost of your gross income, then you can qualify for food stamps or SNAP benefits. The table that the Department of Human Services uses is very complicated. So I barely understand it myself. So the best thing is to do, if you are having food insecurities, then you need to go ahead and apply for SNAP benefits. The other program I want to just touch briefly is the Medicare Savings. And under the Medicare Savings, a lot of individuals need to realize that there's 3 tiers. There's a qualified Medicare beneficiary, which qualifies you for the state paying for your Part B premium, which is your medical coverage that comes out of your Medicare benefits, out of your Social Security check, out of your Social Security check. And it also pays for any deductibles, co-pays, and co-insurance that you might have to pay. So Medicare will pay 80% of your medical costs, and under the Qualifying Medicare Beneficiary Program, QMB, they pay the other 20%. That is paid through the TennCare Medicaid program. There's also another tier that's called Specified Low Income Medicare Beneficiary, known as SLMB, and QI1, which is Qualifying Individual. So there are several levels of Medicare savings that you can receive under the Medicare Savings Program. And we have tables for that. Just need to call our office, or you can go online, or there'll be materials left here at the library for you to look at. The other program that Joani talked about on the 5 benefits is the low income subsidy. And that's a huge, huge asset to individuals who have a lot of prescription costs, especially if they're paying high co-payments or your insurance, it's out of the tier in your prescription drug coverage. A lot of individuals don't realize that you're allowed to have resources. We get a lot of calls for people that may not be Medicare Savings Program eligible, but could qualify for some assistance under the prescription drug coverage. You're allowed to have, as a single individual, up to $7,970 in cash resources. And as a couple, a married couple, $13,290. And a lot of individuals don't realize, just because they got a little bit of income in the bank, that they may not qualify for prescription drug assistance. So when in doubt, always apply. And we can do that for you very quickly. It's a quick process online. Now, I want to focus majority of this time on long-term support services. And what that means is, if you yourself or have a loved one that needs home health care services at the level of skilled care that would be provided in a nursing facility, you can get those services at home, and it's called home community-based services. You may have a greater need and need nursing facility placement. Regardless of your situation, our office can help you with that. And that program under Medicaid is called Choices. And there's 3 groups under Choices. There's Group 1, which means that you medically qualify for the level of care that's needed in a nursing home. And that's for any age. You do not have to necessarily be an elderly individual. You could be a very young person who has had a very unfortunate accident and has become debilitated and is requiring skilled nursing care in a nursing facility. And we can still help you with that application. Group 2 is, I need skilled care nursing, but I don't want to go into a nursing facility. I want to be home with my family, or I feel like I am able to stay at home if I get some help in my home. That is called Group 2, and it's under the home-based care. And then you have group care, which is another category just under the TennCare Choices program, specifically allotted It's a group of money allotted for people who receive disability or SSI benefits and who are low income. So if you have received SSI or currently receiving SSI or any kind of disability income, and you become medically needy, you can qualify for Teen Care Choices under Group 3. Under any of the 3 groups, specifically the 2, because if you're in Group 3, you're automatically going to be financially eligible for Teen Care Choices. You just need to prove that you're medically needy. So if you want to go in a nursing facility, or if you want to stay at home and get home health care, then you have to meet the financial means test, and you also have to meet the physical disability test. Under that program, to qualify financially, you have to have a gross income at or below $2,382 a month, a cash resource limit of $2,000, and need medical assistance. But, I say the big but, say your income is above $2,382 a month, gross income, and you have cash resources more than $2,000. You can still qualify, but there's certain things we may need you to assist you with in order to meet those qualifications. Number 2, if you are at risk at going to a nursing home and you can qualify medically for home-based care services, you have $50,000, $80,000 of cash assets sitting in the bank, you can do what's called a spend down. A spend down is a list of approved methods to spend your money down so that you're below the cash resource limit. And you can use, if you're an individual, you can use this money to pay off personal debt, buy prepaid funeral arrangements, burials, plots. You can do home improvements. Say you need alterations done to your bathroom. So you're now in a wheelchair, you need easy access. That money can be used for that. You need a ramp. Your money can be used for that. You can use it for personal items, but bottom line is you can spend that money down. Or say you've already spent all that money that you need to spend for your funeral arrangements, burial, your home improvements. You can do what's called an annuity. It's called a single premium and immediate annuity, and we can give you the contact of someone who can help you do that. What that means is that money is put in with a contract with like an insurance company, and you get monthly payouts for cost of living, is all that means. So then you can qualify. So that money is, in other words, you don't have direct access to that cash, but you will get, as long as you live, a monthly payout each month. Say you're married, and I get this question and all these concerns all the time. Say you're married and only one of you needs home health services. The non-applicant, the spouse who doesn't need services, can have up to $130,380 in cash resources. So what that means is, more than likely, majority of individuals that we assist in our office don't have more than those kinds of resources. You're going to qualify. Your spouse is going to qualify for home care assistance. If your combined income is more than $4,764. So both of you are married, your both income, and say your income is $5,000 a month. The cap for gross income for home community-based services or nursing facility placement is $4,764. Only thing, what that means is that you will end up paying a little bit each month for those home care services. Or you will have what's called a patient liability if you go into a nursing facility. And there's materials online, and we have written materials that would explain a lot of this information. And as anyone can do, you can call our office and we can help you navigate the financial part of it. Let's talk in detail about the medical side. On the medical side of the Choices program, you have to be unable to do certain activities of daily living without assistance. In other words, if you have to go to the restroom, you can't go to the restroom without assistance. What level of assistance do you need? If you can't even go to the restroom and you're having to wear pins or some other kind of garment, or a bedpan, or a bed toilet, or something like that, what level of assistance do you need? Feeding. You're no longer able to prepare your own meals, but if food is put in front of you, are you able to feed yourself? Dressing. When you get up in the morning, can you get dressed? Are you able to, and honestly, on each and every one of these, the toileting, the feeding, the dressing, the grooming, physical amputation, bathing, there's different degrees in each one of these. And when an evaluation, a medical evaluation is conducted, they are going to ask you the different levels of dressing. Say, clothes are laid out and my husband can get dressed, but he doesn't understand which end of the shirt he needs to put over his head, or whether he can actually put his pants on correctly. Can he button his shirt? Can he, button his pants? Is he able to get his pants down? And there's different degrees of dressing. Grooming. Is someone able to brush their teeth, or is someone able to brush their hair? Is someone able to physically groom themselves where they are presentable, like you and I? What level of grooming that they used to be able to do, shaving, brush their teeth, those kinds of things, can they no longer do? Physical amputation. Can someone transfer from a sitting position to a standing position? Can someone transfer on their own from a laying position to a sitting position? Can someone stand up on their own once they get to a sitting position? There's different levels of amputation. Same thing with bathing. If you get someone, say they have to be assisted into the tub or the shower or on a stool or however they bathe, what level of care, what level of assistance is needed? As you know, all of those are different for everybody and depending on their medical needs. And there's a long evaluation and a detailed evaluation that a nurse will do over the phone or come into your home and assist with that evaluation. Based on that evaluation, it's called pre-admission evaluation, a PAE, and you'll hear us talk about it when we talk to you over the phone about a Choices application. A PAE will determine whether you're going to qualify medically for Choices, home health care services.
And a common issue with seniors when they are called or visited regarding that pre-admission evaluation is they want to make themselves sound like they're more independent than they are. And that's a real issue.
Yes.
So for family members, we really encourage you to be involved with the PAE
Yes.
if possible.
Yes. We get a lot of individuals that we know that are going to qualify medically because we know how limited they are on their activities of daily living. But to talk to the evaluators, oh, yes, I can do that. Oh, yes, yes. Oh, I don't need help with that. Oh, yes. And so immediately they're going to fail because the evaluator on the other end of the phone has to take them at the word. So it's always best that a family member or someone who is the immediate caregiver of this individual is fully aware of what their spouse, grandma, great-grandma, mother, father, whatever, whoever it is in their family that needs care is right there, and they can do the phone evaluation, the PAE, the pre-admission, the medical side of it. If we get them approved PAE, we can work with them getting a financial approval. Like I said, here are the income limits and the asset limits on the couple and individuals for a nursing home and community-based services. There's another spend downs, payments of debts. I already talked about that. Prepaid, home modifications, all kinds, anything, personal items, even clothing, stove, appliances, electronics, food, anything that is related to your shelter costs or just living in general can be used. New pair of eyeglasses. Under home community-based services, you will get, depending on how you score on your PAE, your pre-admission evaluation, you will get personal care. You can be covered under personal care, home delivered meals. In our office, we have the Smoky Mountain Meals on Wheels. That can be a part of your Choices program. You just need to let your care coordinator, once you are approved, your care coordinator is going to be the RN with your insurance company, which is going to be your best friend. She or he is going to be the individual that you are going to call if something goes wrong with the caregiver that's being providing care for you. They're going to be the person you're going to call if you need additional services. They're going to be the person that you're going to call if you need extended services. And if anything changes medically with you, say you were able to do something, but you're no longer able, you may be eligible for additional hours. The list of services that are covered by Choices, that is a small amount. It is fairly large, but that's just a minor touch on some of the things.
And that's why it's called Choices, is because a family or a client can choose what they need the most. So there's a whole page full of home services that a family can choose from.
Yeah. One of the other questions that we get is, and this is one of the toughest ones, is I'm a homeowner and I've always been told that if I take Medicaid, if I take teen care, that they will take my home or my property when I die. The answer is they can, but that's not always the case. So it is a legal question. So if you and your spouse live in a home together, the state, when you pass away, cannot take your home from your spouse. Matter of fact, there's certain rules to that. Joani, you'll turn to next slide. Yeah. The property is sole income producing asset to the survivors, like a family farm or business. There's exceptions to the estate recovery for that. If a sibling or a son or daughter of the deceased was residing in the home at least 1 year before the individual's admissions to a nursing facility or before care started being paid for by the state, then they can continue to stay in there. Bottom line is there's an appeal process and an application for estate recovery. There's exemptions to every situation, and there's ways of asking the TennCare Medicaid program to release assets so that the property will not be paid, used as payment for services rendered. But by law, because of legislation, the TennCare, the state, must pursue estate recovery. So whenever someone passes away and property goes to probate court, there is a question on the petition for probate for TennCare Medicaid. Was the individual provided care, long-term support services through TennCare Medicaid? And you have to check that yes or no. Then the state will be notified. And there's all kinds of great legal individuals in the community which we can send you to get more details on how to protect the family estate if you have a loved one that is going to need TennCare Medicaid services.
Anything else you want to add? This is the end of our slides.
Know that I think, honestly, Joani, we're the best kept secret in Blount County.
I agree. I agree.
And that I think that if you know anyone in your community, whether it's a church member, a neighbor, friend, or just someone that you see that you need to let them know, the Office on Aging has a large field of resources and information and services that we can assist them with, and to give them our number and have them to contact us. That we have a team of 3, myself and 2 other team members that directly do application and support services. And I think that no one needs to be going without home health care services in Blount County at all. There's a way to get help, regardless of your situation.
And the thing to keep in mind is that these benefits that a family is receiving are being paid for or have been paid for through their tax dollars and their work life. So there is no harm, no foul in getting the help that's needed for a family member or for yourself, because you've already paid for it. And we're just here to help you access it.
Absolutely. Absolutely. And it's hard to think about these things when you're dealing with so many emotions, especially when someone gets really sick and it's a sudden illness. There's a lot of emotions behind that, and we understand that. So we're there for you. Just give us a call.
Thanks so much.
Thank you
for listening.
I would like to thank Joani Shaver and Teresa O'Mary so very much for all the helpful information that they have provided for us today. If you, our viewers, would like to watch the program again, it will continue to be posted on our Facebook page, and perhaps you'd like to tell friends or other family members about the program also. If you have any questions, as they mentioned, please contact them at 865-983-8411. Or, of course, for general information, if we can be of help to you here at the library, please call us at 865-982-0981 or visit our webpage at www.blountlibrary.org. Thank you again so much for joining us. Please stay healthy and safe, and whether it's in person or online, we hope to see you at the next time that we focus on seniors. Thanks so much. Bye-bye.